my back! I think I herniated my disc. Let's find out. Talking about low back, lumbar disc herniations. So our lumbar discs are cushions for our spine at the bottom of our spine. Our lumbar discs sit in between the vertebrae, the bones of our lumbar spine, and they sit right in front of the nerves, which is a problem because if that fibrocartilage, which is what the disc is made of, tears and we get like a little herniation, it then pinches on the nerve, and now we have nerve problems because the nerve is compressed. And so that will happen if we're talking about the 5 lumbar nerves. That will happen in what's called a distribution of the nerve. That's usually in the low back, the pelvis, and the lower extremity. So lumbar disc herniations can happen acutely, so that the fibrocartilage will tear, there'll be a herniation, there'll be pinching on the disc, but often it happens over a series of probably months, maybe even years, and then eventually there's a tear, and now we have an issue. We want to make sure that there's no, if the pain is extreme and you have no sensation, or if there's any fever, or you feel like your foot or your leg is dead weight, got to get to the ER. But let's talk about the normal disc herniation. Most commonly we see the 5th lumbar nerve, so that is what's called L5-S1, and the 4th lumbar nerve, so that's called L4, L5, are the most commonly involved. Usually they'll have some pretty intense pain, and also pain can shoot down the spine, shoot down the legs, and also some of this numbness, tingling, kind of like your foot's asleep sensation. If you do feel like you have a disc herniation, it's definitely important to get evaluation. I'm going to talk briefly about the Meeting Point Health Dr. Matter approach. My goal is to really get some healing and repair from the beginning. I use a combination of local injections, that might be local peptide injections, local PRP, and I also do prolotherapy and prolozone injections to start. I want to decrease inflammation and decrease pain and provide some healing and repair from the beginning. I also like to provide some home peptides that can further provide all that benefit, and look towards a combination of how can we continue that healing and repair, and also how do we look towards making sure that we're not doing anything that's going to affect things down the line, and then kind of taking a step back saying, okay, what mechanisms, what things were in place to kind of set us up for this disc herniation, and we'll look at your core, look at the strength of your low back, and kind of see, do we need some hands-on therapy, mobility issues, some strength that can help us prevent that from happening again, and provide some further benefits for your health and your spine. So if you like this video, I encourage you to leave a comment or click the link in our bio to make an appointment to further your health.